Hello guys, and hope you're doing okay and everything is okay on your end. Otherwise, I just wanted to take you through the last end of term, which was the last term's end of term revision for occupational health and safety. So I just want to guide you on how you can answer questions when asked and how you can formulate the statements in order to align with the correct response such that you cannot be denied a mark. So if you start with the first question, it was a recall question. Define the following terms as used in occupational health and safety. So number one was hazard, workplace risk assessment, occupation, OSH policies and procedures. So the first definition comes from the first topic when you're introduced to occupational health and safety. If you define a hazard, we define it as it refers to anything or activity that has the potential to cause harm. So words that are questions that involve definition, you have to use the prefix refers to or it is. So someone can say it is anything or activity that has the potential to cause harm. Another person can use refer by saying it refers to anything that has the potential to cause harm. Because when you're talking about a hazard, we are talking of something that has not occurred, but there is a likelihood of it occurring in case there is no safety or there is no keenness in whatever activities you are doing. So that is a hazard. Then workplace risk assessment. It is enjoined by three words: workplace risk and assessment. So we are talking about your definition you should carve your definition or your statement towards a workplace by associating the dangers or activities that you are doing at a workplace. So by defining, it will say the process of identifying potential hazards in the workplace, evaluating the likelihood and severity of the harm they could cause, and determining the appropriate measures to eliminate them. So there is a process because a process involves a series of activities that are to be done one at a go and then evaluated so that we can eliminate or reduce the chances of potential hazards from occurring. And from our initial classes, we said that you cannot eliminate an accident. Accidents are always there, but we can just put into place some measures to protect or to reduce the likelihood or the severity or to reduce the dangers from becoming worse. So that is a workplace risk assessment. Then there is occupation. I did not define this word, but I just wanted you to at least apply the knowledge. Since you have studied the unit, at least you apply the knowledge of what is an occupation in relation to OSH. So occupation refers to a specific type of work or profession an individual engages in as their primary source of employment or livelihood. That is an occupation. So most people are confusing it with a task. So you cannot define a task as your occupation. I can be able to do a variety of tasks, but that cannot be my occupation. So occupation has to go in alignment with something that you do and you're being paid for it. So it's your area of specialization. That is your occupation. So that's why I said it refers to a specific type of work or profession an individual engages in as a primary source of employment. So the other tasks that you are doing apart from the main tasks that you are employed. For example, if you are employed as a safety officer and you find that after work you're doing some business, then it means that that other side hustle or other business you're doing is not your occupation. It's not your primary source of income. Your primary source of income is where you have been employed, that is as a safety officer. Then you have OSH policies and procedures. This comes from the last topic that we discussed in class about OSH implementation and procedures, where we talked about the rights and responsibilities of employers, the functions of a safety officer, the rights and responsibility of employees, and we talked of nursing and other. It was among the last topic that we tackled. So OSH policies and procedures, policy and a procedure is just a protocol or a guideline. If you go into a company, especially in terms of safety, there has to be laid some protocols to be observed in form of rules. So those rules are just there to guide you as workers so that you can be able to follow them in order to protect yourselves from any incoming danger in your work environment. So that's why there are OSH policies and procedures. So it defined as guidelines used to direct all employees to work safety and prevent injuries to themselves. So that's just an OSH policy or procedure, guidelines or protocols or advice, a form of advice in statement form that is printed in any organization in order to guide the employees in order to prevent them from injuries or damages. So that is how you could have defined the definitions. On to the next question. Identify any 4 rights entitled to employees under the OSH Act. Also, this comes from the last topic that we tackled about rights and responsibilities of employees under the OSH Act. So most people are confusing the difference between an employer and employee. Employee is a servant who is working in the organization. An employer is a person who gave the job to someone to work for them in a company. So as you carve your statements towards the rights and responsibilities of employees, you have to make sure that they touch the employee's side. It should not touch the employer's side. So one of them is right to be provided the PPEs free of charge. And I remember when we were discussing about the rights and responsibilities of employees, I always told you that the first right, before you're being employed as a worker in any organization that has OSH related issues, the first thing that will be done or will be to be provided the PPEs, which is done free of charge. And also when you take for you guys for trips, when you take it to organizations or farms or industries, you find that the first thing that when you enter the gate is you will be given the PPEs. So that is one right. You are not an employee, you are a visitor, but they are preparing you in future to become an employee. So you have to be provided a PPE free of charge. That is the first right. So always remember, when asked any question about the rights to employees, always it should be your first right. The employees have the right to be provided PPEs, those as personal protective equipments, free of charge, because they are the ones who are the first-hand people who are accessing the machines or that workplace that is risky. The employer is not directly associated to the danger, but the employees are the ones who are directly in contact with the danger. So they have to be provided the personal protective equipment in order to prevent them from any incoming or potential hazards. Then you have the right to refuse an unsafe working environment. You as an employee, you have the right to refuse to work in a filthy environment that you feel it's unsafe because it might bring some health related issues and you might end up losing your life, or maybe having that they are called permanent disorders, PTDs. Then you have long-term disorders. So in order to prevent yourself and your health from those associated injuries, you have to refuse to work in an unsafe environment. And you've always seen, you see an organization, people going on strike. They go on strike because they have a right, because most of the demands have not yet been met, and that may include an unsafe working environment. The next point is right to access OSH related records about OSH related illnesses. You as an employee, you have the right to go to the auditor, get some information about what are some of the causes of diseases or absenteeism that is occurring amongst your employees or amongst your fellow employees. So you have the right to access that so that you can be informed on how you can also conduct yourself in order to prevent yourself from being a victim. So that's another right. Another right is right to be trained on OSH education and hazards. And I've always told you that these are some of the key rights to you as an employee. If you go to any organization, the first thing that you are done to, you'll be given an induction. It's called an induction period where they train. They give you some training for over a specific period of time depending on the company's legislations and rules, so that you can be informed of what is waiting for you ahead and you can be able to make an informed decision. So always remember that. And the other thing is right to work in a safe working environment. Of course, the employer has to create a platform where there is a free working space that is protected from any potential hazards, you as an individual, and at the same time the environment that you're working in. By you as an employee, so you have the right to work in that safe environment, but the employer has a right to provide a safe working environment by ensuring that there is a good ventilation system, there is a good air circulation, the workspace is free, there is no congestion in any workstations, each person working has enough space to move around to perform their tasks correctly. And you have right to participate in OSH inspections. There are a series of inspections that are carried out periodically in an organization. So you have the right to go participate in it, whereby if you're in an organization, there's a time where the auditor can come, or the safety officer, or the safety manager can come and assess on the quality of your personal protective equipment. If they are damaged, you have the right to tell that person that my personal protective equipment is torn and therefore I request to get a new one. At the same time, you can report about how the state of your workstation. If your workstation is dirty or if your workstation has faulty equipment, you have the right to report to your safety manager or your immediate supervisor in order to make sure that the necessary implementations or necessary methods are done on your end to make sure that you have a safe workstation. Then you have right to request for a complaint or correction. If you have any doubt about anything, you always have to ask for corrections or complain about something. There are so many channels in which an organization uses that. You can use your immediate supervisor. There is the use of suggestion boxes, whereby you can just go place your complaint in a suggestion box, and at the end of that particular period or week or month, there is a person who will come collect the information and be able to act upon on them. So those are some of the rights of employees under the OSH Act. And I said if the question is reversed, now we have the rights of the employees and the rights of employers. Now you have to carve the questions, your statements or responses in relation to how the question has been asked. So if the question was reversed to employer side, you just use the same, but you just carve the statements by saying the employers have the right to provide PPEs free of charge to the employees in order to protect them from incoming potential damages. The employers have to provide a safe work environment that is free from distractions or that will allow maximum attention of their employees as they work. We have the right to provide education services to the employers in form of inductions. So those are some of the way how you can come up with responses when the question is twisted a little bit, but in the terms of employees. So the next question was talking of list three responsibilities of an employer in ensuring safety. So also from the rights from the previous questions, you could have taken some responses from there or all of those responses and just try to create or to formulate it in order to fit to be among the duties of the employers. So the employer, from the first statement, we talked about right to be provided with the PPEs free of charge. That is from the employee side. So now the employer has to provide PPEs to the employees to guarantee their safety. So as an employer, you have to provide, and I've used to because it's a must. If you do not provide those PPEs, then all your employees will end up being hurt. You'll end up getting losses in terms of productivity in your work. So you just have to provide. It's a must. Then another response is to offer training to employees before participating in OSH activities. And I told you that when you go for an interview and luckily you get the job that is related to OSH related or health and safety, you'll be given an induction, a small training. So the employer has to offer training. They are just trying to equip you with knowledge and skills on how you can handle their specific machines in the organizations in order to prevent you from getting the potential damages or hazards, or from being exposed to hazards. So also that is a mandatory, it's a must for an employer. Then we have another responsibility is to create a safe working environment to employers that guarantees safety. And I've just talked of ensuring that the workstation has a good ventilation system. The workstation is spacious, there is no congestion between one worker or one employee to another. So that is just a responsibility of the employer, because failure to do so, then there will be some penalties that will be incurred to the employer. So he has to observe that. Then we have next to engage the employees in OSH inspections in order to create awareness of existing hazards. So also that is also a right, but I've just tried to curve it in terms of a responsibility. So another responsibility is, as an employer, you have to engage your employees, and during inspection, that is when you can collect immediate data about how the employees feel in their respective workstations. If there is any pressure, you can be able to solve it based on the feedback that you've received from the employees. Also, that is also another responsibility. Next is to put or install suggestion boxes at strategic points in order to get immediate feedback of OSH related reports. So there are some of the, when you meet a management as employees, there are some of the issues that you can be able to raise at that particular time. But you have employees that have fear of maybe addressing their employers directly or face to face. So the employer can come up with a way by installing suggestion boxes at different strategic points, so that a person can just write a small note, put it inside the suggestion box without even identifying themselves. It's just anonymous. And at the end of a certain period of time, the employer can come assess through the complaints, through the compliments put in that suggestion box, and be able to act upon them. So that is how you carve statements when you're asked about something that is a responsibility. Because a responsibility is something that you just have to do it. There is no option. You cannot say that I'll not do it. So just use the prefix to, and I will encourage you to always use the prefix to. If you use that, even the examiner cannot be able to deny you a mark. So if we go to the next question, which was talking of list 4 components of a first aid kit. Some people here are giving very humorous answers. Someone gives of a spirit level. I'm thinking a spirit level cannot be used anywhere in terms of first aid. You cannot administer first aid using a spirit level. So I was just trying to reason with that person, and I was not sure what he was trying to talk about. So if you're told to list any 4 components of a first aid kit, just go with the normal components that you know of a first aid kit. One being adhesive bandages. Adhesive bandages, these are types of bandages that are made of something that is biodegradable. It can decay, or plasters. And that's why you find that it always decays. When the wound gets healed, it decays. We have antiseptic wipes. Those antiseptic wipes are used to kill germs. They can be used to rinse or wash the wounds. Then next we have a pair of tweezers. So we have a pair of tweezers that you're using when performing a minor surgery, and you're trying to seal the wound by the use of a pair of tweezers. Then you have disposable gloves. That's also another keyword. People are saying gloves. You have to specify which type of gloves, because if you look at maybe a welding glove, cannot be able to fit in a very small first aid kit. So you just have to look at disposable because these are types of gloves that are somehow plastic, made of rubber, and they can be able to be folded into different shapes, so that you can put a lot of them inside a first aid kit. Then you have a first aid booklet or manual. There is a small booklet that can be there in order to guide a person who wants to administer first aid to you. Maybe he has no clue of how to start or where to start. So you can scan through the book within a short period of time and be able to administer first aid to you as a person. So it has a first aid booklet or manual. You have the instant cold pack. Especially happens when we have hit someone and there's a small bulge of a wound. You can use an instant cold pack just to calm the severity of the pain. Then you can have a thermometer. A thermometer can be used to record some temperatures. Maybe if someone has fainted, you can use a thermometer to record some temperatures. So these records, when you have finally finished your first aid, if you take it to the doctor, he will be able to go and do some further analysis, because you'll say that this patient fell down, you recorded the temperatures, and these were the temperatures. So it also assists the doctor for further observations and further diagnosis on the patient that has been brought. Then we have the surgical or methylated spirit. You just don't say spirit, because like I told you, there are different types of spirits. You have evil spirits, you have holy spirits. So the examiner will not know the exact spirit that you're talking about. It's either a surgical spirit or a methylated spirit. The methylated is that which is purple in color. Surgical is colorless. It's just like water. So there are two types that you can use. The next is a piece of cotton wool. A piece. You cannot just say cotton wool, because let's say it's 1 ton of cotton wool. 1 ton of cotton wool cannot be able to fit inside a first aid kit. Then we have a burning cream or gel. These are burning cream that can be used to wash. After washing the wounds, it can be used to dress the wound, maybe to make it moist or make it dry. So this type of question is a form of a case study question, whereby if you try to answer that question, you have to look at the aspect of a first aid kit. It's a very small box. So you're looking at the way I'll be responding to my answers. I have to make sure that all my answers fit into that context. I have to put it in a specific way. And you have seen all my responses have been specific. If it's a pair of tweezers, it can be 2, it can be 1, it can be... No, a pair is 2. 2 and above. You can have a piece of cotton wool, a small piece of cotton wool put inside there. So you have to be specific. Don't just say cotton wool. Don't just say spirit. Don't just say wipes. Which type of wipes? They can be table wipes. They can be sink wipes. So you have to say antiseptic wipes, because someone will know an antiseptic. It's a type of liquid that can be used to dress up a wound. So always curve your statements towards the correct way, so that you're looking at an aspect where the examiner cannot be able to deny you a mark, because he will look at all the aspects and he won't deny you. He will give you the mark. But now if you just write it open-ended, cotton wool, you might find that in the marking scheme it is written, if the student has not written a piece of cotton wool, then he does not get the mark. So you always be very keen on that. Then on to the next question. Highlight 4 ways employees show that they are fulfilling their duty to ensure a safe workplace. So this is also another question that also needs a lot of understanding and a lot of context when you are trying to put your statements. So one way is by reporting OSH-related incidents at the workplace to the immediate supervisor for a swift action. So if you report any activity that is undergoing that is making you feel uncomfortable in the workplace, you are fulfilling your duty to ensure that it's a safe workplace, because you underwent the training when you are in the institution or when you are in the organization you are working for, and you can be able to pinpoint some of the incidents that you see can be able to bring some negative effects to your fellow worker or your fellow employees in the organization. So that's also one of them. The next is by ensuring that they put on PPEs all the time when performing hazardous activities at the workplace. So people are just saying by ensuring that they put on PPEs. You cannot put on PPEs when you are going for lunch. That PPE is worn at a specific period of time. When you are performing the tasks, that's when you can pull the PPEs. When you are there chilling out, maybe for a break, you cannot find yourself having a PPE at the break, because you are somewhere. There is always a cool zone where the employees go there to cool themselves up. So you cannot wear PPE there. You'll remove your PPE, go at that, relax yourself within as you wait for your next shift. So you have to ensure that you carve your statements as per to make them complete, and I'm talking of complete, ensuring that they put on PPEs all the time when performing hazardous activities at the workplace. That is the time when we find all of you having the respective PPEs. Then next, by implementing immediately the OSH safety protocols and procedures that they acquire during their OSH training. So if you see that after you underwent the training and we are seeing, or the supervisor is seeing that you have immediately implemented what you're being trained, then in one way or another you are fulfilling what the organization employed you for in that period of time. The next, we have promoting safety culture by encouraging co-workers to follow safety practices and leading by example. So you as also an employee, you're just not employed there to work. You're also a champion of safety, and you're also a brother's keeper. So if you're in a workplace and you see your brother is not having the correct safety equipment, you have the right to tell them that you go and wear the necessary clothing so that you can continue with the work. If it's a teamwork, if it's one of your team members, you can decide to disqualify him out. Tell him or her, go where your PP is, come back and we can continue with the work. So in one way or another, you are fulfilling your duty as an employee by ensuring that there is a safe workplace. Then next, you have avoid risky behavior by refraining from actions that could endanger themselves or others. So if you are in an organization, of course, you'll have undergone some training and some orientation on how your code of conduct at that particular organization. So if you find yourself that you are not doing any risky behavior, or you're not engaging in actions that can endanger yourself, such as maybe operating machinery at unsafe speed, using your mobile phone while at work, then it means that in one way or another you are fulfilling what the organization also employed you for. The next, you have communicating concerns by providing feedback and suggestions for improving workplace safety. This one can be done through employees and your immediate supervisors, whereby you can be able to recommend on how you can improve the protocols, or maybe during a certain period of time, how you can improve the ways or the measures of safety. So that one will always show that you are always fulfilling your duty to ensure a safe workplace. So if you look at that question, you have to make sure that you carve your statements towards a particular aspect and you make sure that they are complete. If you look at most of my statements here, they are very much complete. And if it's a question of 10 marks, in each statement you can get a double mark because you have fully explained yourself. There is no more to explain there instead of writing a lot of paragraphs. So I want to encourage you also to always make sure that your statements are very complete. So on to your next question. It was a case study question whereby it was Limelight Limited has been experiencing frequent hazards among employees. Identify any 4 ways of passing occupational health and safety information to the employees in the company. So this is also a study question. A case study question is whereby they are trying to relate a question in relation to the current world and in relation to you as a student. So one of the ways you have to carve your statements and looking at what are some of the modern ways of me passing information to my fellow co-workers, and what are some of the analog ways that I can use, because we are human beings, specifically Africans, whereby we need to be reminded every time and then. If you have traveled, I always tell myself that I've had a chance to travel in so many countries, and if we go into industries or farms, you find that an European industry or a British industry does not have rules which are written on the door that you have to do this, you have to do that, you have to do this, you have to prevent yourself from doing that. It's because once these people are orientated, they are given the training about something, they implement it immediately and they do it swiftly. That's why they always say that, Africans are always primitive. That's why when you enter, every part has a label. So if you enter an African company, specifically a Kenyan company, you'll find very many rules that are printed on the wall. So that rule, it shows you that these people have to be reminded every time and then, because they're somehow primitive or somehow maybe ignorant. So the question was looking at ways of passing occupational health and safety. So one, you can use emails to alert your fellow employees. I believe if you are employed in an organization, you'll be given an organization email which has your name in it. So you can use that, whereby you can customize an email and forward to your employees. That can be one way. Number two, holding regular meetings to get updated with the current health and safety hazards. Holding of meetings can be formal or informal. There can be at times where during your breaks, you're just at your break, taking some tea or maybe a lunch break, you can be able to converse with your fellow employees on some of just a dialogue, just dialoguing, giving to get updated on some of the events. So it's not necessarily to be a formal meeting whereby there's a HR there are managers or the management is there to oversight the meeting. It can be a formal or an informal way. Then number next is using procedures and videos. I'm sorry, it was supposed to be using presentations and videos to show some of the adverse effects of hazards. So you as an employee, during these interdepartmental forums, you can be able to customize a presentation or a slide. Then you can be able to present on some of the upcoming or the current potential hazards within a workplace. Then next, you have doing regular routine checks before and after finishing tasks. This is always done every now and then, especially when you'll be employed to a company, maybe a manufacturing company. It's called a routine check. They have to ensure that first, every employee has the correct PPEs and they are in good conditions. They have to ensure that the machines are in good conditions, they are working before you are allowed to operate each workstation. So it's called a routine check. Then you have posting relevant updates on social media platforms such as WhatsApp groups. I believe that since we are in the digital era, we can have a common WhatsApp group platform for every employee, for all the employers within an organization. You can have for the subordinates, you have for junior members, senior members. So you can take yourself as people who work maybe in a specific field, create a common WhatsApp group and be able to post some of the updates, maybe from outside world that you see can be beneficial to you as people maybe or as employees in the organization. Next, if conducting a PowerPoint presentation during interdepartmental forum, it also coincides with the using videos and procedures. So those are some of the ways that you can use, and as you have seen, my statements are very complete. So I want also to encourage you on your end that you make sure that your statements are also very complete. Then next we have mention any 3 occupational legislations using relevant examples. This was for part of the research I gave. We have international legislation frameworks. They are called ILOs. We have the regional legislations. The regional legislations, we are talking of European unions. Then you have the national legislations. You have the OSH Act of 1970. You have the 2010. You have the 1999. So those are some of the occupational legislations. I think I'll be able to give a very more detailed presentation on the same, so that you can also be able to capture some series of events and also understand better. Then next we have identify any 4 occupational diseases in the environment. So here also there were some quite a little bit of answers that were not, I was just giving a mark based on sympathy or based on the type of disease that can be given. So people were talking of gonorrhea. I was not understanding the correct way. So at least before going towards those other diseases in that other line, maybe before talking of HIV, AIDS, gonorrhea, syphilis, you just try to twist your mind a little bit to think of the common environmental diseases first in the environment. Exhaust them in a workplace before you can engage into that. So one, you have the asbestosis. So this one can be caused by inhaling these synthetic fibers, and is commonly used in this shipbuilding, constructions, manufacturing industry. You have seen people talking of fiber. Nasikia mtu anakwambia like my electronic gadget imecrack, especially the casing, the outer casings of electronic gadgets. So you take to a certain fundi anakuwekea the fiber in it. It has a very weird smell. Then you have maybe your car maybe the inaweza kuwa na dent, it has cracked the outer casing of your car. You can take to a mechanic. You see people like they always say of pale industry area, there are some certain mechanics who do fiber. They do fiber to you. So that is also, if you inhale it directly, you can get a disease called asbestos. It's called asbestosis, sorry. Then you have the silicosis, results from inhaling silica dust, typically affecting workers in mining, constructions, and manufacturing. So if you are in a mining environment, and that's why you find that most of those people are always given milk, because it just tries to dilute some of the adverse effects that can be caused by them. So if you inhale the silica dust, also the silica dust is a form of mineral, especially those who are working in mines. They can be mining silica mineral ore, and inside that silica mineral ore, in order to blast it, there are some fumes that can be produced, and those fumes can be very dangerous to your health as a person. Then you have the occupational asthma, triggered by exposure to dust, fumes, chemicals, often seen in factories, agriculture, and cleaning services. So that was also something that I could want to see on most of the response, that occupational asthma. So people are talking of asthma. We have that asthma that is a common cold, comes from a result of common cold. But we are just trying to talk about the workplace. So you have to look at how a workplace is. If there is some dust in the workplace, you'll hear people sneezing. Or if you're working in a chemical industry that is very toxic and concentrated, if it enters into your nose, you'll hear a lot of your workers sneezing. That is called an occupational asthma. Then you have carpal tunnel syndrome, caused by repetitive hand and wrist movement, common in office and factory workers. The ankle of your wrist. So if you keep on moving your hands repeatedly, by maybe, it depends on the type of workstation that you are, you will suffer from that disease, and you can be maybe end up being temporary damaged, or having that temporary disability, sorry. Then you have noise-induced hearing loss. Also, this is also another type of disease that I could want to see on most of the responses, which I didn't see it. So noise, because if you're working in a manufacturing industry, there are a lot of noise which is contributed by the moving turbines, moving conveyor belts, the grinding, because it's a manufacturing industry. So if you do not have the correct personal protective equipment, which are the earbuds or the ear muffs, you can be able to suffer from, it's called a partial deafness, because you are exposed to too much noise. And I told you that if you are exposed continuously to too much noise that exists a certain decibel, then you'll end up being deaf. We have dermatitis, which is a skin condition. It can be caused by exposure to some chemicals that can react with your skin. It can also be, it's not necessarily exposure, but also if you inhale, there are some chemicals, if you can inhale them, you start having rashes on your skin. So that is also, dermatitis is also another disease I could want to see on most of the response, which was not the case. Then lead poisoning. Lead is a mineral. It results from exposure to lead, and it can be in construction, painting, and battery manufacturing, some industries, because the electrolyte that is used in batteries is made of lead. So if you find yourself working in a battery manufacturing industry, then that is also one of the diseases that you are likely to suffer. We have repetitive strain injuries. That's also another disease, a very common disease that I could also want to see from your responses. The strain caused by repetitive motions, because if you're working in an industry, you're just not seated at a singular or a single position. You'll be required to move repeatedly, on and off. So that repetitive movement is what will cause you some strain and some fatigue. Then that is what you can use for that. Then vibration, white finger. If you're handling vibration surfaces. That continuous movement of vibrations, especially if you're using the fingers, it can cause some fatigue. So that one can be used in construction, especially it affects people who are in construction areas. So those are some of the occupational diseases that I could mostly want to have heard from your responses. So if you're talking of malaria, some people are talking of HIV/AIDS and other sexually transmitted infections. It brings you totally out of context. So at least you have to carve your statements in response to that. Then next was an application question. Set 5 reasons why occupational health and safety is important to a workplace. This is also something that I did not touch into your notes, but I just wanted you to apply it since you have learned occupational health and safety as a unit. Then at least apply what are some of the importance or the benefits of OSH in a workplace. Number one is employee well-being. Occupational health and safety ensures the physical and mental health of workers, minimizing the risk of injuries or illnesses in the workplace. And that is a major aim of you studying this unit, so that you can be able to be conversant of the environment you are going to work in, especially in industrial environment, and you can also be aware of your surroundings. That is by being able to pinpoint some of the dangers or some of the potential hazards in a workplace. Then you have legal compliance. Implementing proper occupational health and safety measures helps businesses adhere to national and international safety regulations, thereby providing legal penalties and fines. Another important reason, legal compliance. In order to be compliant with the local authorities and at the same time the international authorities, because these are the ones that give out the guidelines in which to them they will guarantee safety of people who are working into those businesses. Then you have increased productivity. So the two major importance, one is employer well-being and legal compliance. Then you have next is increased productivity. A health and safe work environment leads to employees who are more productive, focused, and engaged in their tasks, because you are not affected by any negative effects. Because if you look at an example of a correct or a safe working environment, that work environment, it has no exposure to hazards. It's a clean working environment. It will increase productivity because people will work optimally to ensure that the products or the quality of our services offered are top notch. Then you have reduced absenteeism. By preventing workplace accidents and health issues, occupational health and safety reduces sick leave and absenteeism among employees. If there is a correct and is a safe working environment, there will be no cases of absenteeism, and with that, all employees' rights will be catered for. Cost reduction. Effective health and safety practices prevents expenses related to workplace accidents such as medical bills, insurance claims, and compensations. If you look at those medical bills, insurance claims, and compensations, it's very expensive, and that one can always result when the company or an organization has not observed OSH standards, because an employee can suffer from being exposed to some materials in the organization, and you as an employer, you have the right, because he was working in your organization. If he gets sick, you have to provide the main medical bills. If the employee dies, he had some dependents, maybe he or she had some dependents in him, so there has to be some compensation, and the compensation is very, very expensive, because according to the Kenyan laws and according to the labor laws, if an employee dies while he's in an organization, then you have to compensate the family his salary at that particular time multiplied by 1 year for a maximum of 10 years. So if he was getting 50,000, so he'll take 50,000 times 12. So that is around 600,000. 600,000 times 10. So that's around 6 million. So it's very expensive to compensate. Then to that, another one was enhanced reputation, whereby A company that observes safety and health procedures, it will create a good public image to the surrounding and also to the world globally, thus attracting more potential investments. So that is some of the reasons that you can carve. And if you look at some of my reasons, I'm just trying to pinpoint, I'm just trying to pick or lift from a place where I can see there's an importance. So that is also how the responses were to be made. Then we have state 5 environmental factors taken into consideration in disease transmission. So, the keyword here is environmental factors. So one is climate and weather. If you're talking of climate and weather, you have to talk about temperature, humidity, and rainfall affect pathogen survival and vector breeding, e.g. mosquitoes and malaria. So if you're working in a workplace that it has stagnant water, then you expect that there will be a certain disease transmission in that place, such as malaria, and you have waterborne diseases. Then you have water quality. Contaminated water sources lead to waterborne diseases like cholera and typhoid. Where there is an industry, there has to be a source of water, and if that source of water that is being used, because most of that source of water is used maybe in cooling of machines, it can be used in cleaning of the machine cycle or machine parts. So if that water is contaminated, then you are rest assured that there will be a disease that will come out, which is a waterborne disease. Then you have air quality and pollution. Poor air quality worsens respiratory diseases and facilitates the spread of airborne infections. So if the industry is releasing untreated gases into the environment, that gas will be inhaled by human beings. It can also be taken in by plants, which at later state can bring some damages or some respiratory infections. At population density and urbanization, high density areas increase contact and disease spread. So urbanization may worsen sanitation. If you look at most industries, if an industry is created somewhere, you'll find that the areas adjacent to that land, people working into that industry will tend to live nearby the industry. And if that place is concentrated, then there is a likelihood of the spread of diseases. And if an outbreak occurs, then there's a likelihood to sweep a lot of people, or a lot of people can get infected. So that is how you can carve your statements when it comes to that question. So I think that is section A. I'll be able to come with another tutorial for section B. I hope it will help you to come up with good statements and good responses as we gear our heads towards the incoming examinations, because that is where the trick is. And the trick with these theory questions is they're very easy, but they just depend on the level of understanding and the level of which you'll be able to carve your statements. So I hope this video will help you in one way or another to revise, so that you can prepare yourself for the next exam well equipped, well conversant with the knowledge, and you can be able to apply, because most of these questions you do not expect they will come directly from the notes. It is a type of unit that goes concurrently with emerging trends. So you should be able to apply whatever you have learned in class or through the notes, be able to carve those statements, be able to apply those words into the outside world. So I hope this video finds it deep in your heart to help you understand. I'll create more of them so that you can engage with them frequently at your own free time, and we give in the best at that time when it arrives. Otherwise, have some great time, enjoy the rest of the time, and hope this video finds useful in you.